Hey, it's Dr. Bill with just the tip of urology school, and I want to take a few moments to discuss some pretty common concerns or questions that patients may have regarding the volume and frequency of their urination. So this is good for our nurse practitioners, our uh, physician assistants working in urology, as well as residents and medical students. And we want to pride ourselves in what we do and have a reasonable answer to questions that may seem pretty simplistic that we hear in our clinic. And a lot of people will ask why their volume of urine changes so dramatically from day to day. And the reality is that, remember, we're looking at the amount of fluid that we bring in, eventually goes through a number of physiologic changes, gets to the filter in our body, which is the kidney, and whatever we drink eventually absorbs into the bloodstream, gets to the kidney, it's filtered, and urine is made. So what is it that may change the volume of urine that we make from day to day? First, it's obviously the amount of fluid that we bring in. But remember, the amount of fluid that we take, only a portion of that is converted to urine. Only a portion gets to the kidney to be filtered to make urine. Much of the fluid we drink gets lost through something called insensible loss, mouth breathing, perspiration, sunlight, what the ambient temperature is. If it's the hot, dry summer, we're going to perspire more. Cold, wet winters, perspiring less. So the fluid that we take in will be lost at variable rates and never get to the kidney to make urine. The other thing is we look at the medications that people take. Some are diuretics that make us pee more. People may have medications for management of diabetes that puts more sugar into the urine, and that sugar in the urine acts as an osmotic diuretic. It brings out more fluid. So we may be drinking the same amount of fluid, but we're losing a lot more to urine, a lot more volume because of the loss of sugar in our blood system going to excreted through our urine. Look at the kind of fluids that people drink: alcohol, teas, sodas, coffee. Some may be a bladder irritant, make us feel like we have to urinate more. Some may be acting as a diuretic to make us pee more through making more urine. And then there's the aspect of how our bladder accommodates the fluid that gets to it, whether it is expanding too much or emptying too little. So we think of outlet obstruction, retention, can be from an enlarged prostate or vaginal prolapse in women, scarring at the bladder neck, or scarring in the urethra in both men and women. And also look at the anatomy, the pelvic anatomy, pelvic spasm from people who actually feel anxiety and emotional tension. That may translate into a tightness, into a spasm in the pelvic musculature. And then obviously people who are constipated will have difficulty emptying their bladder. And it is very common in our senior population to see constipation as being one of the precipitating events in men and in women who wind up with urinary retention. And then there's other medications that are not prescribed. Over-the-counter medications like allergy medications actually tighten up the bladder neck in both men and women and be another form of retention. So there's a lot of factors involved. You can give some basic information. Don't make it such a mystery so their patients are not confused. A lot of things you can do with all this information when you try to educate your patient. Dr. Bill with just the tip of urology school.